Smith. My name is Fran. I'm going to be doing your sinus x-rays today. Can you tell me your first name?
Maribel.
And your birthday?
3/1985.
So doctor's ordering some sinus x-rays. You're having some sinus infections?
Pressure
Or?
and headaches.
Okay, so what the first x-ray we're going to do, any chance you could be pregnant
No.
first? No. Okay. And then you've already taken your earrings out. No clips in your hair?
No.
Okay, so what I'll have you do is step up to the board here. We're going to use this sponge to pull your forehead off of the board, so just hold and place it. Okay. So what I'm going to be doing here, I'm going to be lining up the OML 15 degrees off of the board. The CR is going to enter horizontally and exit the nasion. We're using an 8x10 film, and the area of interest we're looking at is the frontal and anterior ethmoid sinuses here. Wind up to her nasion. My technique for this exam is going to be KVP of 70 to 75 and my mass will be 10 to 12 mass. And my marker, I will be placing the left marker just in the shot of okay. Okay, for my next image, we're going to be doing a Waters view, also on an 8x10 cassette. The patient is going to have her chin on the board, the OML 37 degrees to the IR. The CR will be horizontal and exit the acanthyon. Center to the IR. The sinuses that we are going to be seeing with the Waters is going to be the maxillary sinus. If we do an open mouth Waters, you will see the sphenoid. My technique for this will be 70 to 75 kV at 15 to 20 mouths. Patient is shielded and we are do you want to put my markers in the light field, but out of the patient shadow? Okay, now for my next image, we're going to be doing a lateral, also on an 8x10. Patient is going to be in a RAO with her face turned laterally, and I want to keep her interpupillary line horizontal. Mid-sagittal plane is parallel to the IR. My CR will enter horizontal. It will come in half to 1 inch posterior to the outer canthus. My technique will be 70 to 75 at 10 to 15 mass. We do see all 4 of the sinuses in this exam. The most important is the sphenoid that is visible in this exam. My marker, right side is against the board, so my right side marker will go into the light field adjacent to the patient's head. My IOML is horizontal. Okay, for our next exam, we're going to be doing an SMV. We have an 8x10 cassette in the machine. Patient is seated in front of it, she's shielded properly. We're going to have her lean back, the top of her head against the IR. Her IOML is perpendicular and parallel to the IR. The central ray is horizontal and will enter 3/4 of an inch anterior to the EAM. We're going to be using a KVP of 70 and a mass of 20. We're going to be looking at the ethmoid and sphenoid sinuses in this exam. My marker on the board, patient's right side, getting light out of the patient's shadow. That's it. Okay, for our mandible series, I'm going to be doing 4 images. My first one's going to be a PA mandibular rami. We'll be doing this on an 8x10 cassette landscape. My patient is positioned forehead nose on the IR. Her OML is perpendicular to the IR. Her mid-sagittal plane is perpendicular. My CR is perpendicular. It'll enter back here and exit the acanthion. This will show the entire mandible, and it will check for any medial or lateral displacement fractures. My technique will be 70 to 75 kVp at 12 to 15 mass. Okay, patient is shielded, and I will put my left marker on the cassette on the IR in the light field out of the patient's shadow. Okay, for our next mandible images, I'm going to be doing an axiolateral oblique image for the mandibular body on 8x10 cassette. I'm going to be doing a right and a left. The first one is going to be her right cheek to the IR, so we'll be imaging the right side. The MSP is rotated 30 degrees from true lateral toward the board. My angle on my tube is 20 to 25 degrees cephalic. It will exit at the acanthion. This will show the mandibular body. My CR will enter at the mandibular angle, the bonian. My technique will be 70 to 75 kVp at 5 to 7 mass. My marker will go in the light outside the patient's shadow. Okay, so now we're going to do a left-sided axial lateral oblique, also showing the mandibular body. My CR will come in at the mandibular angle, exit the acanthion. Patient is 30 degrees off the mid-sagittal plane toward the IR. My technique is the same, 70 to 75 at 5 to 7 mass. My marker will go in the light. You want to collimate in some, so I'll put my marker in the light field outside the patient's shadow. Okay, for my final mandible series x-ray, I'm going to be doing an SMV, also on an 8x10 cassette. Patient is seated in front of the IR with her back facing it. She'll lean back, put the vertex of her head on the IR. Mid-sagittal plane perpendicular, her IOML parallel. My CR will enter halfway between the mandibular angles and mid-sagittal plane. My right marker will go in the light field next to the patient's shadow. This will show the body of the mandible, the coronoid, and the condyloid processes of the rami. My technique will be 70 to 75 kVp at 12 to 15 mass.